in the sheath. I need to know that this ulna here supplies the whole area with blood. If it doesn't, it pretty much excludes you from having this done, and we would go for a femoral approach. So how to do this, it's called an Allen's test. So you've got a beautiful radial artery there, and I'll just feel for your ulna. Otherwise we'll use Julie's wrist because we know it's beautiful. Okay, so make a fist for me. Open. Make a fist. Open. Make a fist. Open. And now just slightly open your hand. See how white it is? So we've taken all the blood out. So now 1, 2, 3, 4, 5, 6, 7. So it would be okay. Do you remember how pink yours was? Yours just went poof, back.
I'm cold.
Yours is good, but it's not as good as Julie's.
I'm cold.
But that's okay. So what we would do for this is, so at the end of the procedure,
it's all the sugar in the veins.
yeah, we would put this on, and this would go kind of, we'd try and put the cushion on mid-poke. Sometimes the doctors are tricky and they poke down here, so it makes it a lot harder. So sometimes it's not even covered. But most of the time, if they go about here into the radial artery, we can put this cushion on directly over it. Okay. And we put it on, and then we have it like this. So it's nice and snug. Now this is a little, my disclaimer is it's a little bit painful. What I do want to show to you is how important it is that this is the syringe used, because they look the same.
No, they don't.
But they can't, this can't go in, so this has to be the one that goes with it. Okay, so on the side of the band here, you can see 2 mil deflation. It says it in that bit, and that's the safety aspect of it. And this one here says full inflation, deflation. So you can do either or. So when I'm putting this...
okay, I couldn't get the one that we had there opened. How come?
Because you're probably in here. Did it do that?
Maybe, so it's
Maybe.
got that
so
little notch that you got to turn.
Okay. Side. And it's got, you know...
Obviously didn't look that hard.
Yeah. So that's just basically...
Okay, that makes sense.
So it's got 15 mils. So at the end of the case, what the nurse is going to do is going to put the syringe on. She's going to inject 5 in. Then going to take the sheath out, so it's not under too much pressure. Then really, it's quite tight, isn't it? So most people will feel numb in these 2 fingers here, because the lidocaine that we've numbed the area with here causes that. These fingers should feel numb. Should feel normal. Okay. Sometimes you're going to get somebody who's got that kind of bluish tinge, that's cyanotic. There's not enough weight that you're going through. We'll see that immediately, and then we'll release a bit of air. So we try and release as much air out of this to about 10 or more mils. This is a relatively new process for us. We always used to just put 15 in and be done. But what we've decided is I've read all the literature, and the literature basically says, which absolutely makes sense, have enough so there's still blood flow going through it. So if you think about a femoral artery and you put that pressure on it and you occlude it, and if you completely occlude it for those 10-15 minutes that you're holding it, the blood flow's not going through it anymore, and the blood's got all those little platelets which are going to be causing the area to block on up. So that's basically what that would be. So we do want a bit of blood flow to go underneath that. So we do 15 mils, and as I said, then we release 2 or 4 out. See, when we see a flash of blood, then we inflate 2 more to make sure it's good. So you get your first flash and then you top it. Exactly, so we just pop it up on the 2.
Okay.
So you'll see on here, by the time
trying to get the minimum
pressure, for to do the job.
Absolutely.